this is Natalie. She's been my patient now for a few years. She presented initially with multiple headaches, mainly migraines, and we discovered that she has a component of neck pain as well. So we added to just migraines that she's been suffering for years, we added cervicogenic headaches. So today we're gonna do a unique procedure. So we did an MRI to her neck and it showed one level at level 5 and 6, C5 and 6, a little bit of facet joint arthritis and the disc bulge. And talking about facet joints, it's the small joints in the neck. So those joints where the spine connect to the one below and the one above, those are the facets. So what we're doing today is we're doing a double procedure. And we are the first to do this procedure. It's a radiofrequency ablation. So we put a needle in, we hook the needle to a radiofrequency machine for a few minutes that will heat up the nerve, and the nerve will stop sending pain signals to the brain from 6 months to 5 years. But we're adding to that PRP, platelet-rich plasma, into the facet joint, which help healing from arthritis, which help healing the nerve after being heated, and actually increase the efficiency of the procedure from 70% success to actually 99% success. We're saving a lot of patients from going to surgery. So today, there's gonna be her first procedure. So tell me a little bit about your migraines first. How long you had the migraines?
So I've had migraines since about almost 9 years, since I was in a car accident. They turned chronic right around that time, so I was getting more than 15 on average a month. So usually I find I have a lot of neck pain, and then it's going up into my head and causing migraines.
Right, and you've seen other specialists, you've seen neurologists,
yeah.
And what other treatments you had?
Nothing, just medication.
Medication?
Yeah.
Okay, and then we started doing Botox?
Yes.
For that? Tell me how much relief you're getting from the Botox.
So with the nerve blocks and the Botox in combination, I find that I'm getting pretty good relief from the both of them. We do the Botox every 10 weeks and the nerve blocks almost weekly.
Right, you had radiofrequency before just without PRP.
Yes.
How much relief you got from that?
Not a whole lot. It didn't last very long, and it was pretty painful when I had it done.
Yeah.
So I didn't get a whole lot of relief. I wouldn't even say 50% from just the ablation.
All right, and this is actually a huge difference because the pain post-procedure is reduced to a minimal pain with the PRP. So without the PRP, the RFA itself is quite painful, and the pain can be from 10 days to 2 weeks. With the PRP, the patient within 24 hours is pain-free and they can go back to their activities.
Perfect.
Right? You ready for your procedure?
I'm ready to go.
All right, so we're gonna get you ready and we're gonna go to the fluoro. This procedure is quite unique. It has to be done under an x-ray, which we call it the fluoro. And we have a skilled physician here that will be helping me out in this procedure. Right, so now I'm with Dr. Hijazi. Rafiq Hijazi is a pioneer in this procedure. He's been doing radiofrequency ablation and PRP for many years in the United States and now in Canada. And we're doing this procedure to Natalie today. It's her first time. So we're doing RFA in 2 or 3 levels in her facet joints, as I explained. Then he's gonna apply the PRP. Hopefully we'll get her more than 70% relief from her neck pain, which is causing the headaches and the cervicogenic.
Yeah, so here we're combining 2 procedures. One to burn the nerve, the give pain sensation to the joint on the neck. So hopefully it will help with the arthritis pain. At the same time, we're applying PRP, which is platelet-rich plasma, to the same area of the nerve there to help with the regeneration of the inflamed nerve. So combination of both, what we hope it would be more beneficial to the patient.
Right. How long do you think it's gonna last?
We hope it will be more than a year.
Yeah, and that will reduce the pain and the headaches?
Yes.
Okay. We have Natalie here again. She just had her RFA. She tolerated very well, as well as the PRP in her neck. We're hoping for better results this time, almost over 90% success rates. We did her knee with PRP, and we still have some PRP left, so we're not gonna waste it. She rolled her ankle on ice a few weeks ago. We did an ultrasound because the pain persisted, and we found a small tear in one of the main ligaments of the ankle. So we're gonna inject it with PRP. That will indicate 2 things. PRP can be used for fresh injuries, medium or short-term injuries, and long-term chronic pain injuries as well. So today we're gonna do the procedure guided with ultrasound. We're gonna show you the tear on the ultrasound, and Gulnaz will inject where the tear is.
So she has pain on the outer side of her ankle over the ATFL ligament. So I can see there is fluid on her lateral joint line, and there is a small tear in her ATFL, which was also seen on outside ultrasound. So the tear is around here. It's a small micro tear. Basically, she strained her ligament, and because of that, she has fluid in the lateral joint line. So we'll be injecting two areas at the same time, going into the ligament and the joint at the same time.
Would you be able to tell if this is a fresh tear or an old tear from the ultrasound?
Yes, it looks a fresh tear because I'm not seeing any scarring or any calcification, so it seems more like a fresh tear to me, and because there is fluid around it, so it's an acute injury. So this injection is done out of plane. So my midline is where the swelling and thickening of the ligament. So I will be going in line with this. You can see I'm pressing on that, so I know I'm in the right spot. After cleaning, I will be going out of plane. So you're gonna feel some pain now. Okay, all done.
I've done this hundreds of times. Still fascinates me to be able to see the needle going into the joint or going into the pathology and ask the patient, is this the most accurate spot where the pain is? Still fascinating. The patient likes it, I like it. I know that I did a good job, or I'm doing a good job with this. Natalie, after this, will again avoid strenuous activity for a week. She will avoid alcohol, avoid non-steroidal anti-inflammatory, Advil, and all this kind of drugs, but not also this. We're gonna put her in a boot, high-profile boot, so that will leave the tendons and the ligament to heal and glue back together end to end. So we'll put her in a boot for 2 weeks. Then after that, she will start physio and start her normal activities after that. We're hoping that within a month, she will be back to complete healing.